we're moving on to the next session of this workshop, which is concerned with what can we do about all that. And David from Sweden is going to give us a social perspective on obesity. Let's see if I can get that right. Yeah, very good. Okay, welcome, David.
Thank you very much. I'm a social worker, and what I would like to do is just simply contribute some thoughts, not because there's a lot of data or a lot of activity in social work on the subject of obesity, but precisely because there isn't. My own entrance into this field, I don't actually work with obesity as such, is by being married to Christina Fleetwood for 40 years. So I have seen close up when she's been smaller as she is today and when she was bigger as she was before, and all the stages she's gone through in the past. I've been brought along on many such occasions as today. I've read quite a lot of the literature by now, and I noticed today, which I've noticed earlier, that for example Timena and some of the other people have touched on social issues, particularly when they're talking from the direction of stigma, which is Christina's and Rebecca Pools and so forth. But I haven't really heard anybody talk about it with the sort of glasses that we social workers have. Another point along that line is that I teach at the Stockholm University Social Work School, and Christina did previously for a few years. She suggested that to her couple of students as a subject for their senior thesis. They were right on obesity, and it was quite a sensation because nobody had ever done it before. So this, I would simply like to contribute some thoughts based on parallels which I see concerning social perspectives on obesity, because I recognize them with a wide variety of other illnesses and conditions. Oh, it's a little bit slow. Next one, please. What I'm saying is that all illnesses, all conditions occur in a social context. They don't, okay, we've heard a lot about genetics, and certainly that's true, but there definitely is a social context around the person, and that context can either provide support, if it's positive, which may help to reduce symptoms and may help treatment, but can also be, for many cases, a negative context, where the social support is much less or even negative, and this can aggravate symptoms. And without getting in too deep, I've heard people argue in some other areas that it could actually be seen as a root cause, or at least a contributing cause to some diseases. And maybe that's true of obesity. And just to give a couple of very different examples for what this can mean. This example is relatively simple. It's an old source, but it happens to be one I have access to from Stockholm University. This researcher followed people with diabetes for a period of time, and she was interested in what factors could make treatment more or less successful. And she came up with a couple of things I quote here. The first thesis, as she calls it, she says, forward-looking persons, those patients, can, with the help of activities, in other words, being active in their own treatment, and an acceptance of their illness, and with social support in a process of change, gain control over their illness, thus leading to good treatment outcomes. Now, there's a lot more in here than all of the social perspective. This is also about empowerment, which Marilyn is going to do a workshop on tomorrow. We would love to have more space to talk about that now. But it is saying that in a positive process, social support is very important. She found that in respect to diabetes. And another comment she had was that healthcare professionals need to develop a relationship with the patient which is based on trust and understanding of what the illness means to the patient, what the consequences are for the patient, and how this illness influences the patient's social situation. Now this is much wider, and it might not be that a doctor can do all of this, but it is something which has to be considered because it's going to affect whether or not you're going to have that successful treatment. But then to the other kind of example, a much different example, and this is the example where the kind of example where I have met obesity in the field and in research, not identified as a subject, simply as something that comes up. You meet people having problems, and that's dysfunctional families. In dysfunctional families have any kind of imaginable problem. Now think about that the family is not only, as I've written here, the main, at least the most basic organizational form we have in society. It's also where we get our basic safety, none of the least when we're growing up. So if you're going to deal with any kind of problem that you have to have some kind of a safe basis. And if you're in a severely dysfunctional family, then you're not going to have that. But just imagine what it might mean to say, we'll take a young person, say a 14 or 15-year-old girl, developing obesity, and she's maybe gotten some attention from the school nurse, for example, and we're talking about that she needs to eat better, she has to get more exercise and so forth. But when she comes home, she's worried about whether dad is going to be drunk. Is he beating her mother? Is she going to beat her? She has to be thinking about maybe her younger brothers and sisters who she has to take care of. Maybe mom just lies in bed all day, every day. And in this environment, somehow or another, she's supposed to deal with her developing obesity, even with medical support. That thing is, that's severe, and those are the cases that I have met. Now, what about all the ones who are only partially dysfunctional? Where, it kind of looks okay on the outside. People wouldn't think about, that it's not safe at home. And I thought I was trying to think of what might be a possible example, and I thought of, I thought of, say that this 14-year-old has understood that she needs to be more physically active, and she's been bullied for being fat, but she's found some place where maybe she could play volleyball because she has some friends who've been nice to her and might be okay. So the only problem is to get there she has to have bus money, and she has to ask dad for bus money, and she doesn't know whether this is going to be the time that dad is going to be nice and give her the bus money, or the dad is going to get mad and say we don't have money for that kind of thing and give her a big slap in the face and say don't bother me anymore. I think we have to start thinking about these kinds of issues. For a lot of people, it's not that they have a safe environment around them when they're going to have to deal with the obesity problem. So just to say it roughly, kind of hypothetically, how might it be? There's stigmatizing attitudes within families, we know that. If it's also dysfunctional, it can lead to a social network for the child, for this growing person, is either isolated or maybe bullied. When they get to school, these kinds of problems spill over to the school. They don't maybe want to go to school. They don't have attention to study. Studies don't go well. They don't get to go to college later on, even if there were money, because they don't have good grades, don't have good results. This leads to poorer jobs, which leads to poorer employment, which leads maybe to housing problems, even homelessness, if it really goes bad. Poorer prospects all across the board for giving any kind of medical help or help for their obesity problems. I would like to see more of these kind of issues being addressed. And that's what I have to say today.